Adventures. My name is Mary and I'm the co-owner of Two Foot Adventures, an ultralight backpacking store along the Pacific Crest Trail. In today's video, I'm going to be talking to you about what is in my emergency repair kit and what is in my medical kit. Probably the single most important thing I'm carrying is my Garmin inReach. My Garmin inReach allows me to have two-way communication with both my loved ones and emergency responders in the event of a real emergency. These are super lightweight and they're very easy to use. They pair with your cell phone, and again, you can have two-way text communication both with first responders in the event of an emergency and also just with your family. A lot of hikers are carrying these days. I recommend the Garmin inReach over the Spot. I've had a lot of days where when I was using my Spot before I upgraded to the Garmin inReach, where my Spot, I hit it 2 or 3 times a day to send a message saying I'm okay, and my family didn't receive it, sometimes for several days at a time. And so that's what eventually led me to upgrading to the Garmin inReach. So other things here, most of this on this side is going to be my emergency repair, and I have a very light medical kit. I always carry at least a little miniature zip tie. I feel like there's a lot of things you can do with a zip tie, a lot of repairs on a backpack that you could do, or a tent, so forth. So I carry my zip tie, and then I made this little ultralight sewing kit. It has 3 needles and a couple colors of thread. The thing that I like about this is I made this just out of, you can see, an old package, and I fold it back on itself, and I put my 3 extra hair ties that I take with me right over the top. And so I have my hair ties and my sewing kit. I have no needles sticking out anywhere, totally protected. I carry a Sawyer squeeze. So this is my backup O-ring for that. Many hikers will lose those through the season, and so I like to have one on hand just in case. These are my storm matches. In an emergency, I can always make fire. Usually you can strike these even off of a rock or something like that. So I have a couple of those. And this is my mattress repair kit. You can repair a mattress, or you can use the, even this tape, you could use it on a tent or something like that. But this is strictly for my mattress repair primarily. If you're going to be putting a patch on a tent or an air mattress, I highly recommend you also use a little bit of super glue around the edges. It just helps to really seal it in and prevent it from coming off. So I always carry a couple different little single-use super glues. I use those for a whole other host of things. Like if I get a split on my finger sometimes from hiking, it's like it gets really, really chapped. If I wasn't on top of it using my Magoo Magic or any other product, then maybe it'll be bleeding, and I'll take a couple dots of super glue and put them on some of these wounds. And so the super glue has been good for me for that, so I have that as well. Safety pins, again, you can repair your clothes, whether it be a shirt or the button, stuff like that. If you lose your button, you can get by with a safety pin on your pants, and so I like to carry the safety pins. This is just a really small thing of Spectra. You can see mine's pretty dirty because I haven't really used it, but if I had a guy line break, this will be what I use to for that. I've occasionally used it and spread it out as just a tiny little clothesline. So it's multifunctional, lightweight, and is good to have it because if a guy line breaks or for some reason comes off, then and you have a high wind or you have rain, you really need that. Or if you find out you need to add a guy line to your shelter, it's always great to have something for that. Tenacious tape is one of my very favorite emergency repair products. I rarely go to I never go out without it. Every piece of my gear at some point in its lifespan ends up with a piece of tenacious tape or 4. And so you can get them in sheets or rolls. I primarily just keep a couple sheets here. You can see this is a partial one I'm still using. You can use it to patch up a down jacket. You can use it to patch up rain gear, a hole in your tent. People use them on air mattresses. If you're going to use them on air mattress, again, I would have some super glue to put on that. But these are waterproof. They don't really stretch. They're pretty darn sticky. They're clear. So a lot of different uses for the tenacious tape. They're inexpensive. I highly recommend everybody have some. So that kind of wraps up my emergency repair and my replacements like my O-ring. Leukotape is primarily used, or most hikers use Leukotape, and I found that for me the KT tape works better. I have some skin sensitivities to the adhesive on the Leukotape, so I choose to use the KT tape. And my favorite KT tape is the KT Tape Pro. It has a little bit of stretch to it, and it also is more sticky. So it has just greater adhesive, so it sticks to my body better for longer. This is not a waterproof tape, but you can use it to, if you see a lot of athletes, if you're not familiar with KT tape, you might see athletes, especially in the Olympics or in running events, volleyball players are notorious for having just all different colors of tape on their shoulders or on their backs, runners around their knees, and so that is usually KT tape or some other form of that. So I like to have that just in case. I can always support a knee, or if my arches are bothering me for some reason, then I can use it as an arch support, use it to wrap and keep moleskin or glacier gel or something like that in place. For me, I don't typically take any medication of any sort. So I do have a few Benadryls and ibuprofens. These ibuprofens are so old they're falling apart on me. And the Benadryl that I have in there is in case I have some sort of major reaction, or if somebody else around me has a major like allergic reaction that's not, say, anaphylactic. Obviously that's totally next level. You hit your spot. Hopefully they have an EpiPen. I don't have any allergies that I know of that are that bad, but I do keep the Benadryl if I'm having trouble like with congestion, or if I got into some poison oak and had a really bad flare up of something like that. Having a little bit of an antihistamine to get me, say, 2 or 3 days, either back to a town or forward to a town, I find is important for me and can allow me to at least get some sleep when I'm uncomfortable. So I do carry that. But primarily for any other things, even a sprained ankle, something like that, I'm going to use arnica. So I carry a little bit of arnica with me. I always have a few Band-Aids. I typically don't use Band-Aids very much because I'll use a combination of moleskin, glacier gel, and KT tape if I have any kind of blisters. And so, but I do have the Band-Aids in case I'm bleeding and it's a light something, then I can use one of those. You can see I do have a tiny bit of moleskin. I'm not prone to using moleskin for almost anything, but if my little toes are starting to give me trouble, but they aren't blistered, but maybe I've just got a couple hot spots, sometimes I'll use some just really light moleskin on there with some KT tape over it. My favorite thing to use though is glacier gel. If I do have a full-on blister, then the glacier gel comes in 2 different sizes. You have a smaller size, and here's a pack for the larger size. On the smaller ones, I'll typically take and I'll cut them in half. Glacier gel is basically an antiseptic, almost like a spongy padding, and they're a moist pad, and so they will dry out pretty quickly within several days of when you open them. But I find that if I want to use part of one on my little toe or any other small blister, I can take the small pad and cut it in half and apply that and then put KT tape over it, and usually then I can keep it on for several days. That's one of the wonderful things about glacier gel, is if you have a bigger blister, you can take say one of the big pads and put it over it and tape it really, really well and leave it on there from one town to your next town. So if it takes you 5 days, it's fine. You can just leave everything on there as long as you don't think it's getting infected. So it provides a little bit of cushion, a little bit of padding, a lot of healing, and then just further protection from getting worse and from the dirt and debris and so forth. So sometimes I like to use the glacier gel even on those things that are maybe a little bit open, so that they have a nice healing agent on them, and then when you close them off with the KT tape, it allows them to heal. So I always carry the glacier gel, and I'll usually start with a small one, but if I have something larger going on, I've got the option to go to a bigger one. In the event that there's something major going on, I do have a piece of gauze I could always use or cut into a couple pieces and I have some vet wrap. Well, I've always called it vet wrap. I guess they also call it sports wrap now. And this, if I can ever find the edge of it, you can use it to wrap a knee. Let's see if I can find the edge here. It's kind of, it's not really stretchy, but it's self-adhesive, so it adheres to itself. And you can wrap up, like if you twist your ankle or you have some sort of a knee twist or something. So I'd kind of use it like an ace bandage. Usually you can use it a couple of times before you have to throw it away, but basically it's almost a single use. You can see that I haven't had much use for it because I've had mine for a long time and been carrying it for some time with me and not using it, but here we go. You can see it's a stretchy, self-adhesive bandage, and so I like to carry this rather than a bulky ace bandage, mainly because it's lighter and it'll serve a similar function and usually then allow you enough time to be able to get to town to either get medical help, to take a break, or maybe to get an ace bandage if you think that's the right thing for you. And then to clean a wound, I do have one sterile wipe. Primarily, I've been able to get by with just some really minor blisters. My blisters, I'll use my lighter and one of my sewing needles, and I'll run my lighter back and forth to sterilize my needle, and I'll pop my blister and get the fluid out of it, put the glacier gel and then some KT tape over it, and keep hiking. My worst injury I've ever had on the trail for me personally is I was hiking on a glacier and it was late in the day, and as I was coming down I post-holed, and when I post-holed I lost my balance and I inadvertently put my left crampon into my right calf, and in doing so I pulled out this nice hunk of flesh, which was not fantastic. In that case I was able to yell to my buddy who was pretty close by, and I'm not very good with medical, like when I start to see blood and stuff like that. So I just let him know that, and he already knew that ahead of time. But I was able to just direct him to my med kit, which I keep on the outside of my backpack in my outside back pocket. I let him know where it was. He was able to pull it out and quickly wipe things down, put some gauze, put some tape, and that was enough to get me into camp. And then once we got into camp, we actually boiled some water and then we let it cool to a nice temperature, and we were able to run a lot of irrigation through it, and then put a glacier gel patch over that and some KT tape. We did then the next day go ahead and pull it off and look at it, and the wound looked really, really clean, no red or anything like that. So we were able to continue on our backpacking trip. But I tell you that story to basically tell you that everything right here has been enough for me in the backcountry. If you have other medical needs, maybe you need to carry other things, but these are the primary things. I just carry this little comb to comb my hair every now and then. It just happens to live in my same bag. The only other thing that I really, really like for people who are prone to bottom of the foot blisters, like if these are your toes right here behind your toes, or if you are prone to getting really big heel blisters, this mole foam padding is pretty magical. The mole foam padding, you probably won't be able to see in the video, but it's significantly thicker, like several times thicker than the mole skin. So this is 2 sheets of mole foam padding compared to the mole skin. And with the mole foam padding, you're able to form like a bridge so that when you step, you're putting the pressure on the mole foam instead of on, say, that really tender blister. So for that kind of an injury, you would just take one of your pieces of mole foam, and if your blister is here, you'd put mole foam on this side and mole foam on that side. Put a piece of glacier gel over the blister itself and then tape all the way across it using KT tape or Leuko tape. And so if you're prone to those kind of blisters, then when you step, you'll be stepping on the mole foam padding. It'll be taking the pressure off of the blister itself, and that will help for it to heal much faster and bring you a lot more comfort. So if you're prone to something like that, I would absolutely recommend the mole foam padding. Add that to your kit. And any other things that you feel like, if you have other medications that you take, I would recommend carrying extra ones of those. And that has wrapped up my medical kit that I've used. I have carried additional things in the past when I was headed out on the Pacific Crest Trail for my thru hike, and I spoke to my doctor about it. She had recommended a few medications, so that something to stop vomiting, something to stop diarrhea, and something to treat if you got either parasites or some sort of an infection internally, so like an antibiotic. Those were the other things that she had recommended. So she had actually given me just a low dose or a small prescription for 5 days, which she felt like would be enough to get me out, to get me emergency care, but would help to stop dehydration, because that's one of the number one risk. If you are either vomiting profusely or pooping profusely, then that could help to stop that. So those are the other things that I don't carry anymore. I haven't had any of those issues, and so I just felt like after a long time I didn't really need to carry those prescriptions with me anymore. But for some of you traveling from overseas or going overseas to do your hiking, you may find those things useful to take with you. If you have any questions, if you have any other further comments about my emergency repair kit or my medical kit, feel free to leave those comments below. If you like this video and you found it helpful, hit the thumbs up, subscribe to our channel, and let us know what other videos you would like to see. In the meantime, I want everybody to be really safe in the backcountry. Don't get yourself in over your head. If you need to, it's always safer to turn around than to get yourself into a situation where you might actually need your Garmin. So just hope everybody is safe and enjoys the outdoors and everything that it brings with it. So we look forward to seeing you in our storefront in Julian and online, twofootadventures.com. And we hope you have a wonderful, wonderful hike. Happy trails. Bye.